ALS is a neurodegenerative disease that affects something called the motor neurons, and these are the nerve cells that control all of our voluntary muscles, so our hand muscles, our leg muscles, our breathing muscles, swallowing muscles, etc.
This is a disease that progresses rapidly in patients. It can really hit anyone at any time. Typically from onset to death is only 3 to 5 years, and essentially what makes it one of the worst diseases, at least in my mind, is that they become entombed in their body.
So most of these patients require a lot of expensive equipment and expensive medical care. They need family members to stay home and quit their jobs to help take care of them. The idea that we had from the get-go with the Gregory Fulton ALS Center was to not only a good multidisciplinary care model, which involves a variety of therapists as well as the physicians to deliver a personalized plan to each patient. We also wanted to have the things that aren't always present in other ALS clinics, so access to cutting-edge research, community outreach programs, and in-house services.
We're very active as a site in multi-center clinical trials. I think more importantly, we are managing many trials.
We're developing the first ever diagnostic test for ALS. And obviously, in a patient population where the disease progresses rapidly, the earlier you can detect, the earlier they can get into clinical trials, the potential better benefit for the patients and better outcomes for the clinical trial. We're also developing more and more what are called biomarkers for the disease, where we can identify and monitor patients during the course of disease. And some of these biomarkers are greatly beneficial for determining whether or not a particular drug is having a positive effect in patients.
We're the lead site. We're the site that really organizes the trial and makes sure that the trial goes forward in a smooth way throughout the country and often throughout the world. Philanthropic dollars are critical to the success here.